Thanks for joining us on yet another episode of the TSD broadcast. I trust that the broadcast shall spare you to think, speak, and discuss.
My name is Nyasha Sharon. Today we resume our discussion about the burden of cancer in Zimbabwe. In our last episode, we spoke about two things, namely the registration of cancers in the country, as well as the national cancer policy and strategy. So as we continue today, we'll be moving on to talk about the infrastructure of cancer management and treatment. So the main three protocols that are pursued by medical professions with regards to cancer management. First of all, surgery, and then chemotherapy and radiotherapy. These are the standard forms of treatment and management for a person to either be cured or to have stable cancer and to increase the life expectancy. And so we look at the infrastructure that is available in Zimbabwe. We have two hospitals, namely Mpilo Hospital in Bulawayo and Parinyatwa Hospital in Harare, which are the two major public hospitals in the country. These are the ones that have radiotherapy machines. And these radiotherapy machines are supposed to help to shrink the growth of cancers and either totally eradicate the cancer or to shrink it to an extent that it slows down the growth and therefore increases the lifespan of a patient. And so the radiotherapy machines that we have at Parinyatwa and Mpilo Hospital, they're very old machines. They were acquired decades ago. And unfortunately, this limits the scope of cancer management because you find there's continued research, there's continued incidences of new cancers, and these then require newer methods of intervention. The other problem that we have with the machines at the two mentioned hospitals is that these machines are constantly breaking down, and this has a negative impact on cancer management for patients. Because once treatment starts, you have an average of 25 cycles for a patient to have undergone a complete treatment for radiotherapy. So if a machine breaks down, say a person has just undergone five cycles, this means cancer has only been minimally targeted, but it has not been eradicated or shrunk enough for treatment to be effective. And so what happens is that when treatment is stopped midway, the cancer then resumes growth. But as it resumes growth, it becomes mutant to the extent that it then grows in a more aggressive way than before treatment was started, such that it would have been better a treatment not being commenced at all for this patient. The other facility, the only private facility that has a radiotherapy treatment equipment is Onkoke, a private facility in Harare. Unfortunately, as we have this broadcast, the machine is currently broken down as well. And so you see, this is a major obstacle for management of cancer in the country. And we do not have the engineers available locally to attend to repairs of these machines, both private and public. And the reason for this is the issue of brain drain, because you find that when the equipment is installed, there's a training that takes place for technicians or engineers to be able to attend to any maintenance issues. But whether it be due to the unattractive packages, payment packages, or just a general economic decline, many of these engineers are then lured outside the country, and this leaves a drain and a gap in the system. And so each time new people are trained, they leave. And this does not help at all. And so it is the country that suffers, even though it puts in resources into training these personnel. And so, as we spoke in the previous episode, there is need for this for collaboration of efforts between governments and other stakeholders to ensure that we have these resources retained in the country. We have the necessary skills retained in the country, whether it be in ways that ensure that these people are remunerated in an attractive way, or to ensure that they are bonded after training at the expense of the taxpayers' money. But there just needs to be a common ground among stakeholders. And we've spoken about the antiquated equipment. And this is something also that there needs to be collaboration amongst different parties, whether it's the political authorities, whether it's the health professions, whether it's academia, and even private players, commerce, those in commerce. They may think that the cancer burden does not affect them, but it does have a great impact on them when an employee is it's chronic disease, chronic conditions such as cancer, and they need long-term treatment, and so it's a burden even on the benefits that accrue to the company, because these skills that this person is supposed to provide are no longer available because this person is constantly on sick leave, which they are entitled to in terms of the law. And so there needs to be this collaboration of efforts. You find that a number of the big companies, especially mining companies and manufacturing companies, they have clinics. They have clinics at their locations, and so if there's if they are able to invest further and to ensure that cancer, really the burden of cancer is they take charge of it in their own small sphere of influence, and there's this access to treatment, access to whether it's x-ray equipment and the like, it just makes life easier, even if it's not at the primary level but at community level. It's a social responsibility level that would really assist, if they put in funds and say, in our community, in our district, in our province, these are the funds that we are providing for treatment of cancer. You find that when you look at cost of radiotherapy equipment, if you're looking at second-hand equipment, it ranges anything from around 300,000 US dollars to 1.5 million for the more recent versions of second-hand radiotherapy equipment. When you're talking about the newest equipment, it ranges from around 3 million. And when you just look at this figure, it's just a drop in the ocean with our GDP as a country. So you find that really, if there's a common ground amongst the various stakeholders, we'll be able to acquire more effective linear accelerator machines for patients to be able to access the necessary treatment that they need. And then the other thing is surgery. There's also need for surgery, in management of cancer. And so we're looking at the state of our hospitals. I mean, we're just in a serious economic decline, and right now you find many people are not able to undergo surgery because of various reasons. Look at the costs of surgery. The medical practitioners, the surgeons themselves, they charge you an arm and a leg. I mean, we may not begrudge them because they went to school for that. They trained for that. But when you look at the average person at this point in time, we don't even need to look at the person in the rural areas. Here in Harare, here in urban areas, you find that the middle class person will not even be able to afford the costs that are presented to them for them to undergo surgery. So sometimes a person is just told they need to go for surgery. These are the costs involved, and they just sit back and just await their fate. And so this is something that needs to be managed. This is something that needs really for all stakeholders to come on board. And as I mentioned in the earlier broadcast, there is need for a cancer levy, because cancer is a slowly growing pandemic in the country, and it's something that is going to catch us by surprise, and it's going to overtake HIV and AIDS. There's been so much concentration on HIV and AIDS, but we then find that there are other diseases that are coming up, like cancer, and that are going to have a huge impact, and that are quite expensive to manage, such that there will come a time when they'll become a burden, right up to national level, where they'll become a burden on the national health systems. And then the other issue with regards to treatment and management of cancer is chemotherapy. Chemotherapy is just as expensive as radiotherapy, because it's with cancer you cannot just have in once-off treatment and say I'm done and dusted. And so with chemotherapy, you find that the average person needs to have maybe 6, 8, 12 cycles depending on the type of their cancer, and each cycle costs about an average of minimum 200 United States dollars. And this is for somebody, it's a salary, it's a monthly salary, it's something that's supposed to cover, like your whole household budget, your food, your rent, your electricity, and your basic day-to-day transport if you're going to work. And so this is an amount then that you're expected to set aside just for cancer treatment for one person in the family. So you find that people just usually just forgo, they just forgo treatment because they cannot afford it. Or when the family comes together and says we're going to pool resources to try and manage this disease, they can only do so for a short period of time before they cannot go any further because it is just so expensive. And so the issue of cancer infrastructure really it's a so it's really a sore thumb in the economy, and it's just a time bomb. It's a time bomb because we just look at cancer and we look at it as a disease next door, you know. But when you really look deep, you find that each family, just about each family, has been affected by this disease, and there is need for everybody to come on board as we're going around our day-to-day business. Let's just talk about this. Let's just discuss this. Let's not shy away from talking about it, because the moment we want to speak in hushed tones about it, it means that we are not willing to come out to take action to be able to manage and to reduce incidences of cancer and to reduce mortalities around cancer. And why I mentioned the issue for collaboration, I keep talking about collaboration, is that it helps everybody around. It helps everybody. You know, it helps the slice of cake to be shared equally amongst everybody. You know, the thing that bleeds my heart right now is when I talk about radiotherapy machines. You know, you find that it's currently Parengatwa Hospital is the only place where we have a functional radiotherapy machine, and this is after months, many months of this functionality. And so now this is a public institution, you know, it's funded by taxpayers' monies. And it's supposed to be the place where, you know, the low income patients are able to approach to be able to get treatment. But what is currently happening is that private patients, you know, attached to private doctors or doctors in private sector are the ones that are getting preference. Why? Because they're able to pay the amount that is required for radiotherapy, which is in excess of $1,000 United States. And so they're able to pull their funds and go and pay. And because Parinat was not getting the necessary allocation, you know, for cancer management from the health budget, as was stated in the cancer strategy in 2014. They're not getting that necessary allocation in the health budget. So yes, they'll take the private patients because they're the ones that are going to bring what? Income. They're going to bring revenue to the institution. But what does this do? It then crowds out the poor people. It crowds out the low income patients. And so the cake then gets to be shared only amongst those that can afford to get treatment. And yet the hospital is funded by public funds. And so this is something that we really need to look at. This is something that we really need to look at. As I spoke earlier, you know, my father succumbed to cancer. So we tried to get to pull the funds. We could not do so. We tried to highlight the costs of radiotherapy machines. And it's something that we failed to do. We tried even to get public media, you know, to hear our plight so that this could be broadcast. But unfortunately, it did not materialize. Yes, they held interviews. My father gave an interview to public media, and unfortunately, the interview was never broadcast. But I just hope that as we speak, as we discuss, and as you listen to this broadcast, it is something that will move you, and it is something that will enable you to take action, to speak about, to discuss with your peers, and realize that, you know, the cancer burden is not just a burden for the person next door, it's a burden for you and me, because the majority of cancers are infection based. And you know, you may think that you're fine, you may think that, oh no, this is just a cough, you may think that, oh no, this is just I'm just feeling something funny in my throat, you know. But if you're not screened, if you're not tested, you know, you may get to a point where when it's too late, it is diagnosed as a cancer. So right now, let's do the right thing. Let's discuss amongst ourselves. Let's take the necessary action that is required for us to eradicate cancer in Zimbabwe. So in our next episode, we're going to be discussing the costs of treatment and management of cancer in Zimbabwe. Don't forget to like, share, and subscribe to this channel. And until next then, think, speak, and discuss.